So many families have watched their loved ones die because pills ran out. Not in a movie, not in Somalia, but in Botswana in 2025. A mother in Botswana now walks several kilometers only to be told there are no ARVs. And the man whose name is on every tongue right now, 37-year-old Dr Stephen Modise, the Minister of Health in Botswana. Some already call him a murderer. Others say he's the only doctor brave enough to walk into a burning hospital and try to put out the fire with a garden hose. Tonight, we decide, is he a criminal or an innocent man caught in the crime scene? Let me tell you why this one cuts me deep. In 2025, this year, I lost a homeboy to TB, proper TB, curable TB. He was on treatment, doing everything right, doing just fine, until Princess Marina told him, drugs are finished, come back next month. Next month, he was in a box. And every time I see Dr Modise's face in the news, I remember my homeboy's mother asking, why did they let him die? So tonight isn't a theory. It's very personal for every one of us. Let's start with his resume, because half of the country thinks he's a Tinder doctor who just got lucky. Dr Modise has a Bachelor of Biomedical Science. He is also a Doctor of Medicine. He has a postgraduate certificate in medical education. He has a master's degree in health professions education. He is the youngest health minister in Africa at 37. On paper, this is beast mode. In Shakawe Clinic right now, they are using Panado for hypertension because the real drugs are finished. So how did we even get here? Botswana's public health system has been hemorrhaging since mid-2025 with empty shelves for ARV medicines, TB drugs, cancer treatment, and basics like insulin. We hit peak panic in August when the president declared a national public health emergency. By November, it became a full meltdown. Hospitals started rationing and patients trekking hours for pills that aren't even there. Some were being asked to bring their own swabs, syringes, IV fluids, and many more. Labor unions blamed leadership failure under Dr Modise, calling for his head, saying poor management, wrong priorities like fancy audits over meds, and inaction turned shortages into a total collapse. Modise was accused of downplaying the crisis, with the leader of opposition calling him a murderer. Bofepuso straight up said patients are dying under his watch. On social media, he trended as Dr. Death for weeks. One lady in a Facebook comment wrote that her sister died waiting for insulin, saying Dr. Modise got blood in his hands. But is he the real criminal, or he was just found wanting in the crime scene as a first responder? Here's the timeline of events. Dr. Modise took over in November 2024, and the crisis exploded in 2025 under his watch. Unions reiterated that his poor management deepened it. That is, he had no quick fixes on issues raised, including the doctor strike that took place in April this year. It is a no-brainer that the UDC inherited BDP's failed state, destroyed by corruption, poverty, poor services pre-2024. The economic crash hit the country post-elections, making things worse for Dr. Modise. I took time to visit some of the clinics around Gaborone, and most of them were at around 36% in supplies of critical medication. I spoke to several medical practitioners based where I couldn't reach, and each one of them has a horror story to tell. On X, people have been posting funeral videos and pictures for victims who have been failed by the government that they voted for and trusted. From the defense point of view, They say Dr. Modise inherited a ministry that was already bleeding from the BDP era irregular tenders. Diamond revenue crashed, budget for drugs was cut by 40%. America pulled PEPFAR funding the same year Trump came back. And they say he's the one who went on national television and admitted that we have a crisis, when the previous regime was denying everything. He's said to be allocating money to deal with the crisis. He has flown to WHO and he's been begging for generics from India. And what is government's response to all this? The president recently said they discovered that there has been an organized corruption cartel that siphoned public funds meant for the procurement of medicines. Here is the president speaking at a recent rally in Maung.
Bona kgang ya melemo mo dipateng ke le supeletse gore go ha isile gore ha le ta bona gore jaanong go tlwaetse le tlo bona batho ba bopeletse ba seka bogodu jo ba bodi go emeletswe ga go rekwa melemo ka bogologolo jone hela ha morago ga COVID ga ikgobokangwa ka dikomponinyana tsa masika le ditsala ba tsama ba go bata melemo e senang le ha ile ditanka e sa amogelesege mmone melemo a te kwame mo di warehousing jaaka ke bua le lona ya ko ga borong melemo e rekilwe ka madi a lona ye go itseweng gore ga e lekelesege mmone counterfeit ye leng gore ebile ha le ka enwa e ka le lwatsa kana ya le bona ine ya rekwa o bona burukhuti ke selo se ke se itseng ke se lemogang ha se tsama khakala ka bo ke setse ke bona gore go na le burukhuti hale mme go ga ke ithaganele ha o thothomisa ga o tsose modu o ba le sa gore ba tsaya gore ga o ba bone ba tsaya gore o se le mme jaanong di simolla go hetoga le wa la hetoga dikarabo di a go tswa ditlhaloso tse di tlhapileng tse di tlhamaletseng gore melemo e la e reka jang madi a le e rekileng ka one a ga le bone gore a ka bo atamela batho gompieno viva umbrella viva.
Back to Dr. Modise. People keep saying he's a murderer. Let's be real. Nobody found him with a smoking gun. But when a preventable death happens because the system you run has no drugs, in the court of public pain, that feels like murder. And pain doesn't care about multiple degrees or good intentions. Here is where I learned, family. Dr. Modise is not the devil, but he is also not Jesus. He's a young brother who thought reform speeches and PowerPoint slides could fix 58 years of rot in just 8 months. He stood in front of cameras smiling while the shelves were empty. That is tone deafness. He let unions drag the fight into the streets instead of locking them in a room and hashing it out. This is weak leadership. But is he guilty of murder? No, I don't think so. Is he guilty of being human in an inhuman situation? 100% guilty. And who are the real criminals? The real criminals are the ones who looted health tenders for decades before he even had a stethoscope. The system that ties our survival to diamonds and dollars from Washington. And all of us, yes, us who vote tribe, vote promises, then go quiet when the bill comes. Dr. Modise, if you are listening to this, and I know somebody in your office or someone you know is, stop the speeches, get on the road, get on the ground, go to the clinics, hospitals, and other health facilities. See the empty shelves yourself, then fix it. Or Get out of the way so that someone else can make an attempt to fix this. This is the court of public opinion with Uncle German. We don't just talk about the fire. We walk through it with you. Stay safe and tell a friend to tell a friend. We out.
Hey,